Hi, I want to talk a little bit about private health insurance subsidies, which are now costing us, the taxpayer, $8 billion a year. So the background to this is that when Medicare was introduced, which is the public health insurance system, in 1984, people deserted the private health insurance system because they had a really good public option. And of course, the private health insurers were not happy about this at all. So they came up with all sorts of ridiculous arguments and say, oh, it's going to threaten the public system and all of that. And eventually, when Howard came into power in 1999, they introduced a 30% rebate on private health insurance. Now, this is just basically a government subsidy to prop up the private health insurance industry. Then they introduced another thing called lifetime health cover and the Medicare levy surcharge, which are basically ways of punishing people for voting with their wallets and saying, we want the public health system. So they're punishing people and forcing them into private health insurance. And so now the total cost of this is up to $8 billion a year. Now, funny that, because $8 billion a year is about the amount that is estimated that it would cost to provide everybody in Australia with free dental care under Medicare. So why are we propping up private health insurers who need to pay their CEOs and their advertising campaigns and all their fancy offices in downtown, expensive business parks and so on? Why are we forking out $8 billion to subsidise this system? It doesn't make any sense. We've got to scrap it, and we need to use that $8 billion for real public dental health on Medicare. That would be a much better solution.
Authorised by P. Boyle for Socialist Alliance, Ultimo, New South Wales.